It shouldn't be taboo to talk about my vagina. For years, I would get abnormal paps, but I wasn't comfortable questioning doctors. I was diagnosed with cervical cancer at the age of 35. 4 years later, I'm not afraid to speak up for myself.
Hello everyone, my name is Bhavya, pursuing degree second year from Ignite IAS. Nowadays, we see a lot of people on internet discussing about cervical cancer, especially on social media. So today I am here to explain what this cervical cancer actually is. Before getting into the topic, let us know why it is in use. Our PM, Shri Narendra Modi, in his conversation with Bill Gates, had stated that his new government will allocate funds to scientists for local research in cervical cancer and provide vaccination for all girls. So what is this cervical cancer? Cervical cancer develops in women's cervix, that is, the entrance of uterus from vagina. Cervical cancer usually develops slowly over time. Before cancer appears in the cervix, the cells of the cervix go through changes known as diplegia, in which abnormal cells begins to appear in the cervical tissue. Over time, if not destroyed or removed, these cells will become cancer cells and start to grow and spread more deeply into the cervix and surrounding areas. So what are the causes of this cervical cancer? The primary risk factor is HPV, that is human papillomavirus. Cervical cancer is caused by persistent infection with human papillomavirus. Women living with HIV are 6 times more likely to develop cervical cancer compared to women without HIV. HPV 16 and 18 are causes of 70% of cervical cancer worldwide. The other risk factors include smoking and passive smoking, weakened immune system, long-term usage of oral contraceptive pills, co-infection with other sexually transmitted agents, lifestyle factors like multiple sexual partners, young age at first sexual encounter, immunosuppression, and improper diet. So the common symptoms are vaginal bleeding after intercourse, between the periods, after menopause, and menstrual bleeding that is heavier and lasts longer than the usual, watery bloody vaginal discharge that may be heavy and have foul odor, pelvic pain and pain during the intercourse. Here, if you see, we can find 2 types of diagnosis. The first one is HPV test. In HPV test, they look for the virus that can cause cell changes in cervix. And the second one is Pap test. In Pap test, they look for the precancers and cell changes on cervix that might become cervical cancer if they are not treated appropriately. Prevention. Prophylactic vaccine against HPV and screening and treatment of precancer lesions are effective strategies to prevent cervical cancer and are very cost effective. The treatment for cervical cancer include surgery for cervical cancer, radiation therapy for cervical cancer, chemotherapy for cervical cancer, targeted drug therapy for cervical cancer, immunotherapy for cervical cancer. If we take a glance at global risk profile, according to WHO, the cervical cancer is the 4th most common cancer in women globally, around 660,000 new cases and around 350,000 deaths in 2022. In the same year, about 94% of 350,000 deaths caused by cervical cancer occurred in low and middle income countries. The regional differences in cervical cancer burden are related to inequalities in access of vaccination, screening and treatment services, risk factors including HIV prevalence, and social and economic determinants such as sex, gender, and poverty. If we look at India's risk profile, as per National Cancer Registry Program, cancer of breast and cervix uteri are the most common cancers among female. About 365.71 million women over age of 15 live in India are at the risk of developing cervical cancer. Papampara district in the state of Arunachal Pradesh in India have the highest incident rate of cervical cancer, that is 27.7% in whole Asia. According to WHO's International Agency for Research on Cancer India accounts for roughly one-third of cervical cancer deaths worldwide, with 132,000 newly diagnosed cases and 74,000 fatalities yearly. It is estimated that 6.6% of women in the general population currently have cervical infections and HPV infections. Vaccination in India. As of 2023, there are 6 HPV vaccines available globally. All protect against high-risk HPV types 16 and 18, which cause most cervical cancers and have been shown to be safe and effective in preventing HPV infections and cervical cancer. As a priority, HPV vaccines should be given to all girls aged between 9 to 14 years before they become sexually active. Cervical is the first Indian-made HPV vaccine by Serum Institute of India, approved for girls and boys aged between 9 and 26. Other vaccine is Gardasil 9, which provides protection against 9 types of HPV that are responsible for major HPV-related cancers. The vaccine is approved for the use of both in male and female aged 9 to 45 years. As of latest information, Gardasil 9 is priced at Rs 10,850 per dose in India. India's first indigenously developed quadrivalent HPV vaccine, Cervical, has the potential to improve access to vaccines and revolutionize cervical cancer prevention in these countries. Developed by Serum Institute of India, one of the largest vaccine producer in the world. As production is scaled up, the institute hopes to be able to make doses of Cervical available to the public in a price line between 200 and 400 in near future. The Vaccine Alliance Gavi signed a new 3-year partnership with the Indian government in February 2023 with the aim to extend life-saving vaccine to millions of children nationwide, including helping the country introduce the HPV vaccine into the country's India's nation immunization regimen. And in February 2024, the government announced the vaccine would be a part of Universal Immunization Program following endorsement from National Technical Advisory Group on Immunization. If you look at WHO's global strategy, it defines elimination as reducing the number of new cases annually to 4 or fewer per 100,000 women and set 3 targets to be achieved by the year 2030 to put all countries in the pathway to elimination in the coming decades. Apart from active immunization, large-scale screening of cervical cancer along the masses, awareness campaigning also focusing on effective cancer treatment protocols can enable India to overcome cervical cancer menace. Prevention of HPV-associated pre-cancers and cancer is also a key element of WHO's health sector strategy on HIV, hepatitis, sexually transmitted infections of 2022-2030 and World Health Assembly resolutions WHA 74.5 of 2021 on oral health includes actions on mouth and throat cancers. Thank you.